Hi guys, what's up? Welcome back to my channel. Today is a super exciting day. This video has been highly requested so many times. Like, this is like one of my top highly wanted videos. So super excited to sit down and film for you guys today. If you guys love my nursing videos and you love seeing new videos pop up on your feed, make sure you are subscribed and make sure you give this video a thumbs up for more videos. All right guys, so let's just go ahead and get right into the purpose of this video. Today I'm talking to you guys all about getting your first nursing job interview and nailing it, acing it. It's gonna be great, it's gonna be amazing. You're gonna do so well with these tips, I promise. So I have my phone right here and I have a complete written out what I'm gonna talk about. It's kind of a lot because I have a lot to say about this. This is a strong point for me. Interviewing is, I really do enjoy interviews. They're really nerve-wracking when it's the first job of like your main career, aka this past one was my most nervous, scariest thing ever, but it really doesn't have to be that way if you prep for it and you're ready and you just are like mentally prepared for what's about to happen, because I feel like that's the best way to go into an interview. So hopefully these 10 tips will help you, and if they do, make sure you share this video, share it with a friend. You know, nursing community, we all can benefit from each other around here. So I am going to start out by telling you guys about my nursing interview. I get a lot of questions. This isn't even written down, I'm just thinking about this now. A lot of nursing students ask me when they should apply for a job, and there's no right or wrong answer. And I also want to say that my tips in this video may not work for you and your specific facility you're applying to, but they're pretty basic and broad, so hopefully you can use them in some way. But my tip for applying was, I asked around a lot and got a lot of good advice from people. It just kind of depended on where you were going, what you were doing, where you were applying to, like where they like wanted you to, like, oh my God, when they wanted you to apply for the job. And the best thing I can tell you is to ask around, you know, people who have gotten jobs there, or if you don't know anybody that's gotten a job there, you know, research online. Most of the time the websites will have like a new grad nursing program of some sort. Like mine has a residency program, some don't, and that's perfectly fine. You know, I looked into hospitals that didn't as well, but you know, look into that, and it will typically tell you, you know, apply 1 month within graduation, 2, 3, whatever, or some of them don't have anything, so you can apply when you want. But my tip would be 2 months, 1 month graduation. I applied for my job 1 month before I graduated, and it was perfect. Was I applying before that? Yes, that was when we were moving to Chicago, so I had applied for a couple in Chicago, but I would say the 2 month, 1 month range, leaning more towards the 1 month range, because you know, people get so excited and they're like, I need to find a job, and it's like, realistically, you have a lot of school to finish and you still have to pass your boards, which is like a 1 month after graduation. So just kind of think about that and really research into your facility and what they want. All right, so let's break down these tips, guys. I'm super excited. My number one tip that we're starting out with in the 10 is be comfortable with being uncomfortable. A lot of people have never had a job interview. Some people may be watching this video and they've never interviewed in their life. I've had a few different interviews. I worked as a CNA, I worked as a nurse tech, I worked in retail before I started anything in college. And the number one thing you need to know is you're going to be uncomfortable. Point blank. It's not the greatest time talking about yourself. I mean, unless you like doing that a lot, but like, when I say talking about yourself, I mean you're talking about what you're good at, why you're better than other people, and sometimes it can be uncomfortable. I'm not super comfortable being like, I'm better than, you know, you had to think of it like you were applying against your classmates in a way, and you had to kind of think in a way of, why am I better than them? Like, why should you hire me over them? And you have to go in that kind of a mindset for an interview, and it can be a struggle. So making sure that you are comfortable with that, being uncomfortable, you're going to need to talk about yourself, your accomplishments, you know, why they should hire you, all that jazz. So just know, starting right off the bat, you're going to be uncomfortable, and you need to be comfortable with that, and you will with practice. Tip number 2, be prepared. I know you hear this for interviews. I know you're gonna look them up on Pinterest and they're gonna say, be prepared with blah, blah, blah. Yes, okay, there's so many different ways you can be prepared for an interview, and I did every single one of these. The number one thing is you need to have in your mind some situations and scenarios. So if you are just starting out in nursing school and you're watching this video, start writing down situations that you think you could use in an interview. So maybe you have a journal, or maybe you put something in Google Docs, interview folder. I'm serious, have this. It'll pay off in the end, and like along with your resume and your cover letter and stuff you'll do throughout nursing school. But you know, think about scenarios like, just to name a few, they're going to ask you, and I'll like give you guys a list of questions that I utilized in my interviews, but they're going to ask you a time you dealt with a difficult patient. That's like the most basic question they're going to ask you is, tell me a time you had a difficult patient and what did you do to resolve it? So you can start thinking about clinical situations that maybe you had a problem and you fixed it, or you had an issue with a doctor or a family member, or had a really cool patient and how you handled things. And you know, they're going to ask you situations in clinical. So just keep that in mind as you're going through school. You know, think of things. You don't want to get to the end of nursing school, and if you have a really bad memory, I really do recommend getting a journal, but it was really easy for me to think of things beforehand in an interview and just be like, oh, this was a time I had a difficult patient. This was a time that I had to deal with a family member. And I could also think back to my CNA experience, which is also why I highly recommend being a CNA. You get a little bit of different experience being a nursing student and doing nursing role versus an aide, where you're actually really flipping hands-on with that patient and their family. I mean, you are with them, you're doing everything with them. Like, it's a really good experience to get different scenarios that they could ask you in a job interview. Another one I'm thinking of just off the bat, which I will give you guys my list of questions, but like adversity, that's a question that I've always seen is, tell me a time you dealt with adversity. Tell me a time that you dealt with something you were uncomfortable with and you had to resolve it, you know, because obviously nothing in nursing is always completely comfortable, so they're gonna ask you things like that. So just being prepared to answer those questions comfortably and confidently, that's what they wanna see. Alongside scenarios, you wanna have a list of questions that you have run through yourself and written out and like responded to them. So I'm going to give you mine right here, but when you're answering the questions, you wanna like type them out on your phone and answer them how you would talk through them. And that's what I did, was I wrote out all these questions on my notes app, which I'll show you here in a second. And then I wrote my answer as to how I would say it. And when I was driving my interview, I literally just kept reading through the questions, or I would have Sam ask me the question and I would just ramble off. Because you're not gonna be able to say it exactly as you write it. It's not a script. You don't need to be like that, because you don't wanna be like robotic when you're in there, but like you wanna be like, hey, this person prepared for this, like this person had this in mind before they came. You know what I mean? So writing them out is definitely key. When I say answering a question like a scenario, you wanna talk to the interviewer like you're telling a story. And that's what I do. Like my heart's pounding obviously during an interview. You're gonna be uncomfortable, you're gonna be nervous, that's totally normal, but you want to ease into it like it's a story. Like tell them about, they're gonna ask you why you got into nursing, what got you into the field, and you can say the most cliche response if you want to, or you can tell your real truth and your story as to why you got into nursing. You know, tell a story about, mine is when my mom got bacterial meningitis and she was seizing on her bed and I saw the whole thing. I followed the nurses, you know, the ambulance, everything. Like that was a life-changing experience for me that made me want to get into nursing even more. So giving them something like that is really authentic and real and just makes you more appealing than the typical interviewee who might say, I've always wanted to care for people. Like don't say that. Like if you that's the only thing you can think of in the moment, go with it and ride it. But if you can tell a story, it's going to make you way more intriguing to the interviewer. Okay guys, I'm getting right up here close and personal. So I'm going to read these to you and I will type them out here on the screen so you can see them. These are the questions that I have if you would like to steal them from me and use some of them. A time you have stood out or done more than enough. Why do you want to work in this department? A time you have noticed a deteriorating patient or condition change. That one's huge. Keep that one. You need to know that. Like think of a time you saw it, because you will. A time you used evidence-based practice. That's another huge one. I got that question and I had to think about it. I was like, shit, what? And a tip for that is I talked about evidence-based practice would be like why washing your hands is beneficial, walking after surgery, how that's evidence-based. Range of motion exercises in bed is another example. A tough patient and how you handle it. I talked about that one. How did you de-escalate the family in a hard situation? That's another one. These are all nursing great things. Dealing with adversity. Why did you become a nurse? That's the one you want to tell a story about. Tell me about yourself. I can talk about this here in a second. Your weaknesses, strengths. Why should I hire you? How well do you handle criticism? That's huge. A time you had a different point of view of a patient and how you dealt with it. What you have done that shows initiative. What do you know about our facility and our values? Tell us how you work under pressure. Career goals. So long-term goals, they might ask that. Salary goals and wants, I'm gonna talk about money, so don't just take that and run with it. Hang on. Are you a team player? And do you have any questions for us? So those are just a few that I wrote out. Like, these are my interview questions that I wrote out my answers to all of them and recited them a quadrillion times. So that's just a couple questions that you can use if you're looking for some. Otherwise, I know there's some other lists that you can find nursing interview questions, but those are just a few of the most basic ones to get you started. Tip number 3 is, I mentioned it in that question, is to research your facility and where you're applying. You need to know things about where you're applying. I mean, you can't apply to an interview and expect them to just be like, oh, you answered everything great and you're great and we're just gonna hire you. Like, they may ask you, why do you resemble with our values? Why do you feel like you would be a great fit for this specific facility or this specific floor? You wanna make sure that you researched ahead of time. And just a prime example is, look up the hospital's mission statement, and typically you'll be able to find their values. I mean, these are things that they share with their patients, doctors, families. Everybody that works in the hospital should know these things. So if you know them ahead of time, that's like massive brownie points, and they're going to remember you, the fact that you knew their values, their mission statements, what are they trying to accomplish? What do they live by every single day? And if you can know those things going in, you're a step ahead. Tip number 4 is to prepare a list of questions you would like to ask yourself. I do actually have those on my phone as well. I can read a few of those off. But you really, really want to have questions in your mind that you can ask them at the end of the interview. They'll say, do you have any questions for us? Say, absolutely, I have questions. I have my little notepad here and I have them for you and I'm going to ask them, because you want to sound interested. You want to sound like you truly are passionate about this job. It's everything you've ever wanted. Like, even if it's not your number 1 choice, which maybe it's not, that's fine. But this is your first job. This is your first nursing job, and it doesn't even matter. Like, you want to sound like you're interested. So a few questions that I have are asking about patient ratios. That's super important. Length of orientation, scheduling, shift options. I have weekend pay on here, but that's only if they initiate the money conversation first. Opportunities for advancement. So that would be like charge nurse, all that stuff. How many nurses on nights versus days, which that may come up with the patient ratio question. And I also have on here like nail policy, like nail polish, tattoos, piercings, and I have this on here because I have a nose ring, I have tattoos, and I love having my nails dipped. So I asked those questions on my interview personally, but those are just a few. There's so many more you can ask about, like different things, unless you have other questions too. Like, have a list written out. And it truly shows like the most, I'm interested, hello. Tip number 5 is all of the basic logistic things about a job interview. You want to dress professionally. You want to look up business casual, and if you don't know, if you've never interviewed before, really go and look up what business casual is. I recommended wearing I wore dress pants. I wore a dress, they're from Old Navy. They're really, really cute. I'm not a slacks girl, and like the baggy, I don't do that. Like I just don't like it. I mean, you're gonna use them at different points in your career, so investing in a pair isn't too bad, and Old Navies aren't very expensive at all. I had on closed-toed shoes, and they were heels, and then I also had on a black blazer. So I went the all black route. I think I had a pop of white here and there, but dress extremely professionally. This is the job that you want. This is your career. So making sure that you are professionally dressed is just obvious, key, common sense. What to bring to the interview, I have a notepad, it's like a portfolio that we got from school. So if you can go to Target or Walmart if your school doesn't give you one, and just plain, don't be doing colors or anything like that. A neutral color, gray, white, black, and it just has a notepad in it. You can have your questions in there. You wanna have copies of your resume and references. If you can, always bring your resume, your cover letter, and a copy of your references if you have them. That's not necessarily necessary. I've never been asked for any of those things, but they're just like common things that you wanna bring just in case they ask for it. It's just nice to have. So those are the things you should bring with you. Tip number 6 is a firm handshake. I don't even know if I can do this with myself. Firm handshake, eye contact. Do not be sitting here playing with your hair, shaking your leg, which is some nice gray sweatpants with my sweater, shaking your leg, playing with your hair, fidgeting. You don't want to do any of those things. So making sure that you are practicing eye contact. This comes with like practicing interviewing just in general. You want to keep eye contact with your employers. I had 2 people in my interview and I made sure to equally talk to each of them. If they were speaking to me, I was looking at them, eye contact. Typically looking like right here is just like the most perfect eye contact instead of like awkwardly looking at one eye. Making sure that you have a firm handshake with each person. It doesn't matter if they're casual, always, always, always right when you get in there, you know, handshake, handshake when you leave. Just making sure that you're respectful. I mean, you wanna be the happiest you've ever been in your entire life. You are bubbly, you are passionate, you're ready to go. Like, this is your job, this is what you want. You need to be fully all in. Tip number 7 is about salary money. So I get this question a lot. You know, what am I supposed to put in the interview slot online when it asks me what am I requesting for a salary? Well, obviously you've never worked a nursing job before, like an actual RN job, so you don't want to put on there like an outrageous salary. I a lot of times say negotiable if they're able to type that in, because typically they're going to start you at the basic, you know, basic wage for a starting RN. So that's probably what they're going to do. But if you have to put something in there, just look up in your area, because it's different everywhere, what the typical starting wage is for a brand new registered nurse, BSN, LPN, whatever it is. You know, just look it up and see what the average is and put the lower number, because they're going to start you at a certain wage. They're not going to probably go off of what you say, but could be wrong. So just pay attention to that, but always be negotiable. Don't ever talk about money in the first interview unless they initiate it. Do not sit there and say, you know, what am I going to make at this point? What am I going to make here? You know, when do I get a raise? Like, I personally have never done that. I don't recommend it. And from the advice I have received from other people is don't do that. You know, they will talk about it if they want to talk about it. And if they want to hire you, you're going to hear about your salary. You're going to hear about your wages at some point. So hold off on the first interview, because this is just the beginning. Tip number 8 is some professionalism at its finest. They're going to ask you about previous experiences. They're going to ask you about your preceptorship. They're going to ask you about previous jobs, previous employers, your experience. Don't ever talk negatively, ever. It doesn't matter if you had the worst internship experience of your whole life. You do not ever talk negatively about anybody you've ever worked for or worked with. Some interviewers may be inappropriate and like say things, but like you never want to stoop to that level, because they could be trying to trick you. So don't ever do that. If you didn't like your last job, it doesn't matter. It was wonderful and it was great and you had a great time and it was just the most amazing job. That's all you have to say. Like, just you don't have to talk like that if you really did hate your job, but don't ever talk shit about any employer. Like, just don't ever do that. You are a professional, you know, you want to be professional, and you want to keep that vibe going. So never talk negatively. Always be positive, uplifting, warm, kind. Like, that's what you're going for. They want those people. Tip number 9 is a follow-up. So you've done the interview, it's been a wonderful or it went crappy, it doesn't matter. You want to hear back from these people regardless, right? So my tip is to send a thank you email or handwritten note. I've never done a handwritten note, but every time I've looked up stuff, they're like, handwritten note. I'm like, I don't know how I would do that, because this day and age, people typically email me. So I send an email the next day. So if I had an interview on a Wednesday, I would send the email on Thursday to whoever interviewed me, you know, just thanking them for their time, thanking them for the opportunity, and that's really all you have to say. Looking forward to hearing from you, because if they tell you in the interview, oh, you hear from us in this amount of time, then that's great, but still thank them for the interview. You know, they took time out of their day to sit and talk to you, so that's a huge, huge, huge thing to thank them for. Just the opportunity in general for a position is just an incredible, amazing opportunity. So making sure to send them a thank you email the next day is my recommendation. Other people may disagree with me, but that's always worked for me. So, and they've always been super kind. So I don't know if it's just who I've interviewed with or what, but as for calling them, the recommendation is 7 to 10 days. If you have not heard from them in a week of your interview, that's when I typically pick up the phone. If I'm really interested in the job, I will call them in a week, but I won't call them any sooner than that, because they have other things going on. You know, they're managers, they have a whole entire floor to run, so they are not focused on just you. So just keep that in mind. I know it's the only thing you're gonna think about, waiting for that phone to ring. Okay guys, and tip number 10 is all about applying to multiple places. I got the question on my interview. I only had one job interview and got the job, but they did ask me if I was applying anywhere else or if I had any other interviews. And I was really like taken back from it, because I didn't have anything else, but I was like, oh my God, what if I did? What was I supposed to say? Like, I don't know the right thing to say. But Sam had this situation. He had a couple job interviews and a couple different things going on, and he was honest and said, you know, yeah, I had an interview in this department because it was at the same place. But I think being honest is the best. I don't know if you necessarily need to say what department, but being able to say like, yeah, I have a couple interviews, or yeah, I have another interview, or whatever, just being honest. I don't know exactly what the right way to go about it is, but I feel like being honest is best. You don't want to say like, no, I don't have anything else, and then you like go next week and have a dream interview, and because you never want to like make bad blood with anyone, because you could end up on that floor someday, or you could want a job there someday. So always making sure that you're honest. I think that's my biggest tip for number 10 was applying multiple places. Tell them if you have more interviews. You know, they know that you're a new grad. They know you're trying to get a job wherever you possibly can. So yeah. All right, guys, those are my 10 interview job tips for your first nursing job position, how to nail it, how to ace it. You're going to do amazing. I'm just telling you, preparation and practice makes perfect, you guys. Walk into that interview confident, be ready to talk about your accomplishments, list everything you possibly can on your resume. That's a totally different video of what you would put on your resume, because that took me, like, I had to research that because I just like didn't know for sure what I needed and what was good, what was bad. 1 page, 2 page cover letter. I had 2 pages, by the way, for everybody that tells me that I need one. But yeah, that is everything I have for you guys today. If you enjoyed this video, make sure you give it a thumbs up. Comment down below what other nursing videos you guys would like to see. I have millions of things I could talk about. So hopefully this helps somebody out there, and I love you guys so much, and I will see you guys in the next video. Good luck with your job interview.